This is a skills session on ECG recording, and we're going to demonstrate the correct limb lead placement for the ECG to be recorded. So the equipment we need is a ECG machine that's fully functioning and charged, and that all the leads are correct and the connectors are clean and intact. We're also going to need ECG electrodes, and it's important that these are in date and that they're not dry, just to make sure that they adhere correctly to the patient. And we're also going to need some hand rub just to attend to our hand hygiene. So the first thing we're going to do is going to attend to our hand hygiene first. So the next thing we're going to do is we're going to explain the procedure to the patient, and this is important so the patient understands why the ECG is being recorded, and also it allows the patient an opportunity to give us their consent to undertake the procedure. We're going to make sure that the patient is in a comfortable, preferably semi-cumbent position, and any variation to this may interfere with the ECG recording accurately. So now we're going to apply our chest electrodes. So for V1, we're going to apply it at the 4th intercostal space at the right sternal angle. So we're just going to measure out 1, 2, 3, and 4, and at the right sternal angle. Similarly for the V2 lead, we're also going to use the 4th intercostal space, this time at the left sternal angle. We're going to leave V3 just for the moment. For the V4 electrode, we're going to use the 5th intercostal space, this time mid-clavicular line. And just making sure it's mid-clavicular. Our V3 lead can now be placed midway between V2 and V4. Our V5 lead will now be placed on the left anterior axillary line. So our axillary line is here at the same level as V4. Our V6 lead will be placed at the left mid-axillary line at the same level as V4 and V5. For our limb leads, we'll place one on the left arm proximal to the left wrist. We'll also place one proximal to the right wrist. And one electrode proximal to the left ankle. And one proximal to the right ankle. We'll now attach the leads to the electrodes. Again, making sure that the lead clips are all intact and that they're clean. So our first lead is indicated. In the Marsden manual, you'll see it's identified as V1, and on your ECG leads, it's C1, C2, etc. So we're just going to attach just onto the base of the electrode. In order. So we have C1, C2, C3. And for our limb leads, The left is the left arm, and the green F lead is for the left leg. For the right side, the right arm is indicated by the red R lead, and the black N lead is for the right foot. So it's important that all the leads are as flat as possible, and also during the procedure, while the ECG is being recorded, that the patient remains as still as possible, and this is just to help prevent any movement which can result in artifact presenting itself on the ECG recording.